Hello, my name is Geneva Goodwin. This presentation is regarding end-stage renal disease leading to dialysis and the infection risks associated with dialysis. Learning objectives. Um, I'll be defining the population of interest. I'll be defining end-stage renal disease, how it leads to dialysis, and infection risks associated with dialysis. I'll be discussing the 3 levels of prevention and the role of advanced population health nurse in the 3 levels of prevention. Also, we'll be discussing the pros and cons of not seeing the benefits of screening. My population of interest includes male or female between the ages of 65 to 75 years of age. These patients are receiving dialysis and are at an increased risk for dialysis infection at their dialysis access site. This is particularly so because of their age, because of their skin vulnerability, and due to their not healing as they normally would, as someone younger normally would. End-stage renal disease typically occurs when there is a decrease in urine elimination, or just stop the function is very low, or the kidneys fail to function altogether. There are some common medical illnesses that contribute to end-stage renal disease, such as diabetes and hypertension. Patients report the signs and symptoms of feeling fatigue, inability to eliminate urine. They'll have a decreased appetite, weight loss, nausea, skin itching, swelling in the around the feet and ankles. So what happens after kidney functions has stopped? After the kidney function has totally stopped, or there's been a decrease in the blood, begins to build up toxin. Now I want to talk about the prevalence of end-stage renal disease. Globally, there was data taken from like 142 countries, which is about 97.3% of the world's population. That's a very high number. The data showed that global percentage of prevalence of end-stage renal disease patient with diabetes increased from 19% in the year 2000 to 29.7% in the year 2015 worldwide, while the percentage of incidence of end-stage renal disease patients due to diabetes increased from 22.1% to 31.3%. Globally, annual incidence of end-stage renal disease among patients with diabetes increased from 375.8 to 1,016 per million during the years of 2000 to 2015, with the highest average rate being identified in the Western Pacific region. Comparatively, the rate of incident end-stage renal disease among European patients with diabetes ranged from half to one-third of the rate of the Western Pacific population during the years of 2000 to 2015, according to the American Diabetes Association. The data was also collected from Fresenius Medical Center, Germany, and previously reported data. How is end-stage renal disease treated? For some people, dialysis would be the answer. For some people, kidney transplant. For some people, they cannot afford a kidney transplant and they do not want dialysis. So the alternative or the next level is, if there's no treatment and there continue to be toxins build up in the body, then there's death. But for this presentation, we're going to be talking about an implantation of a vascular access device. There's 3 different types. There's the fistula, there's the graft, and there's the catheter. The fistula is a connection, a natural connection between the vein and the artery, which helps increases in size to increase blood flow. With the graft, it's a synthetic inserted device that will help with to increase blood access, increase to the body, to the veins. It's synthetically made and it's connected to the vein and the artery. Then you have the catheter. The catheter is temporary. It's usually inserted into the chest or into the neck until a permanent access could be used or inserted. This is just a picture showing an AV fistula, which you also see that the dialysis machine has been inserted to the AV fistula. Remember, the fistula is a naturally connection between the vein and the artery. Infection prevention at dialysis access site. There's a great need for infection prevention in these particular patients. Due to there's a high rate of hospitalization and mortality rate. Infection prevention is the key for decreasing infection, especially catheter-related bloodstream infection, also known as CRBSIs. There are contributing factors such as human factors, which can be caused by poor technique in insertion of a catheter, or that leads to infection, improper or poor hand hygiene, failure to use disinfectants on dialysis surfaces or dialysis equipment, and just even improper cleaning of the access site. I want to talk about the advanced population health nurse. The advanced population health nurse will take on the role of promoting and encouraging patients to just to live a better lifestyle, to promote counseling, to promote or encourage them to do screenings for early detection of disease or illness, promoting exercise to help fight against conditions such as high blood pressure, diabetes, stroke, and even encouraging patients that are smoking to stop smoking, and educating them on the risks of smoking, such as lung cancer, emphysema, and other forms of cancer, and to use alcohol in moderate situations. There are 3 levels of prevention as an advanced population health nurse. I'm going to discuss the first one is primary prevention. Primary preventions look at preventing the onset of the disease or the illness. The includes promotion, education, even promoting immunizations for people. They will identify patients at high risk for developing a disease or condition, and encouraging this overall lifestyle change. Second level of prevention is called secondary prevention, which focuses on detecting and early prevention of disease or an injury. As the role of the advanced practice nurse, you promoting routine screening, routine checkups, routine lab work, just an overall good health. Encouraging patients to get their mammogram, to get the pap smear, to get the prostate exam, have eye exams, have routine lab works. Promoting early detection is secondary prevention. The third level of prevention is primarily focusing on, once the disease has happened or occurred, is to maintaining and rehabbing or having a good healthy lifestyle. It includes addressing the illness with the patient, helping the patient to manage the disease or the illness, and decreasing negative potential side effects that can occur. Promoting decreasing further complication related to the illness. Are health screening important? Yes, it's very beneficial. With health screening, they are early detectors of risk factors for many patients. They are extremely important for those patients who are genetically predisposed for disease or illness. These screenings are based on gender and age. They're especially good for some people who don't display any early signs or symptoms of any illness. Just as many believe there's a beneficial factor to screening, many believe that screening can be overused. They believe that This is the reason for rising costs in healthcare. They believe that this can potentially be physical, psychological, and financial harm to patients. Many believe that this could lead to overdiagnosing patients and overtreating patients.